Hey, Average Joe here. And tonight, I apologize. Let me bring that up a little bit for us. So tonight we are going to go over why therapists do what they do. And this is going to be in regards to those muscle groups that I talk about. And this one is going to be on the quadratus laborum. So I've talked about that in the last video. And if you want to look at that, you can go ahead and just click on my particular website. And you can see that particular one that really focused on the do's and don'ts. Why is it so important, that particular muscle group? And we're also looking at the stretching. There's 2 stretches that you need to do for that particular muscle group when it gets aggravated. So hopefully you'll go and look at that one. We're going to start out with research number 1. This was done back in 2014. Effects of core exercise programs on pain and active range of motion of chronic low back pain. So this is a peer-reviewed journal. It is a little bit older. It is 9 years old, so we're going to see if it holds up to the test of time. And so this one specifically, the study was identifying, does exercises really, hey, how you doing? Thanks for coming. And we're looking at, does exercise really help pain when we're talking about, hi, Kimmy. So we're looking at, does these specific exercises really help low back pain issues? So we're going to go look at that real quick. Hello. Okay, so essentially what they did is they did 3 times a week for 4 weeks. So 3 times a week for 4 weeks. Then they did these exercises for 30 minutes. And they basically asked the people from 0 to 10, 10 being the worst and 0 being no pain, what would you rate your pain at before, when they started at the first day, and then halfway through, and then at the 4 weeks. So they were looking at chronic low back pain. And one of the main muscles that they were looking at is the quadratus laborum. They didn't have a lot of people in this study. This was the only problem that I had with it. They only had 15 people. So out of, that's a very, 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 very small study. But in this case, what they looked at is they had patients who had spinal or lower limb operations, which had signs of inflammation and pain in the nerves, as well as down into their back. So the actual exercises that they used were flexibility-based exercises and basic stretching range of motion exercises, trying to bend forwards, trying to bend backwards, and then trying to bend side to side is what they looked at for those particular ones. And they said, okay, they went and did all that. Let's see what the results were. So significant differences were observed between patients at rest with pain and then with movement. While the control group did not show a significant difference, basically the people that didn't do any exercise at all in regards to pain, they said that the core group with that particular muscle group, the quadratus laborum muscle, they showed it at initially was a 4 out of 10. So 4 being kind of like the middle of the road, 10 being the worst pain. And then they said at the end of doing everything after 4 weeks, they basically said their pain was a 2 to 3 out of 10. So it was definitely less, their pain was, from when they started 4 weeks for when it was early. So there's a lot of weaknesses to this study. So one is that the sample size, the number of people, was very small. The next problem is it is over a pretty good length of time. And if you're just using one unit, in this case, the visual analog scale, or what we call the VAS, which is that 0 to 10 scale, it really doesn't really give us a lot of hope in regards to, okay, was there something else that could have changed their pain besides what we were doing treatment-wise? So I'm going to give this one, out of a 5, I'm going to give this one like a 1.5. I'm not going to give it a very good because there's a lot of poor things with this particular study. But it does iterate that one muscle group, the quadratus laborum, that gives a lot of people pain, which I've talked about in the past. And it also goes over specifically that hey, if you do some exercises and your pain is coming from that area, which I've shown in my last video, then you're probably going to have less pain. Are you going to have zero pain from this particular study? No, you're not going to have zero pain, but your pain's going to be less than when it was before you started exercising at all after 4 weeks. So a 1.5. Not a very good study on that one. Not too impressed with it. So the next study was done. This one is, you see, that's the problem with this particular muscle group. This particular muscle group was really researched heavily back in the late 80s and early 90s when physical therapy was really just starting to come into its own. Prior to that, you really had chiropractic, and you had medical doctors doing like blocks and injections and for medical doctors, and then for chiropractors, they were trying to justify, spinal manipulation and traction and mobilizations to try and reduce that particular muscle group. And now, over the last, 10 years or so, when it comes to this particular muscle group, it really hasn't come around again to where people are looking at it. So in this particular study, it was countermeasures against lumbar spine deconditioning in patients who have been in bed for quite a while. So what they're looking at here is what I've talked about in the past, is the fat tissue that after a while starts to get into the muscles. And this particular one they looked at is obviously the quadratus lumborum. So this was a study, like I said, it's from 2010. So this is an older study. We're talking 23 years ago. So we're going to see if any of this stuff is true today. So they looked at 24 subjects under 60 days of head down tilt. So looking at people that were having issues whether they're a spinal cord or some sort of car accident, they're looking at where they couldn't move very well. And so they were immobilized for basically 60 days, almost 2 months, right? 2 months. And it was 24 people. And they looked at, performed resistive exercises. Okay, it was 8 people out of the 24. And then they looked at 2 other muscle groups. They looked at the multifidus and they looked at the erector spinae. So I'm going to be doing another video probably this weekend on the 2 muscles, the erector spinae. I always say that wrong. Erector spinae and the rotatory muscles. So those are the muscles that really initiate movement in the lumbar spine. So I'm going to go ahead and do that one. Let's see if I can get this spine on here, because you're not even seeing the spine, the one that I moved. So these muscles right here, literally, what I'm talking about, the erector spinae literally line right on the bone, and then the rotatories are on an angle. The rotatories is exactly how it sounds. It helps rotate the muscles, or each segment. It helps rotate the segment. I'm sorry, it doesn't rotate the muscle. It rotates the segment. And then the erector spinae helps stabilize and then initiate deceleration with bending forwards and then extending back. So think of those 2 muscle groups. They are really huge muscle groups. And I'm going to be talking about those hopefully this weekend in a new video. So they did a cross-sectional area of those 3 muscles: the multifidus, the erector spinae, and the QR, the quadratus lumborum. And what they did is they did MRIs of the low back and those muscle groups, and they looked at, okay, was there any fat deposits in those areas? So they looked and basically said there's little statistical evidence for any additional effects of whole body resistance exercises along with these particular muscles. Exercise subjects reported low back pain more frequently in the first week of bed rest, but there was only one significant, there was only one, I always want to say the word one. There was only significance in resistance exercises. So this study was fairly strong. It had a p-value of 1, so it's a fairly decent study, at least from a physical therapy standpoint. What they looked at is they were thinking of, okay, if people are going to go to outer space or in outer space, whether it's to Mars or whether who knows where, and they were having an issue, what type of issues are they going to have with decreased weight bearing or weightlessness and they're looking at, immobility in the spine and what will that make a difference or not. So they looked at the lower back. They looked at those 3 muscle groups that I talked about. And like I said, they did the MRIs, and I'm just going to show you one of the MRIs right here in the picture. So they're literally looking at the L1 to S1 area is what they were looking at. And I can kind of show you here. You can see the before and after. I'm going to leave a little X here on this one. You can see that area right there where I circled. Hopefully you can. It's kind of dark. I apologize if you can't see it. But it shows where the disc has gotten flatter down and tilted like that along the S1 area. So down here, this last disc, this last one here, was flattened and tilted forwards with that non-weight bearing for that period of time, for that 60 days. So it really doesn't take much of immobility to really start to affect change in the spine. So they looked at those particular pieces. So they looked at disc height, they looked at those muscle groups, and they did a whole bunch of particular regression of those muscle groups. And they looked at vertebral height of those particular vertebrae, and then extrapolated that with the muscle groups. So, I'm sorry, the other muscle group they looked at also was the psoas. So it was the multifidus, the erecti spinae. They looked at the quadratus laborum and the psoas. And so that psoas muscles I talked about in the past, that psoas muscle is the muscle that runs straight down in front of your hip here. It's your main hip movement as well as bending forwards. It kind of does a couple things. Couple main things. It helps with deceleration of the spine and stuff like that, but that's what most people think of. I don't want to melt my model here with my candle. So they basically said here, after doing some resistance exercises, so this is their discussion, after doing 6 weeks of exercise, after being immobile for 60 days, pretty much 60 days. The main findings of present studies was that the high load resistance exercises performed for basically short periods. This was done 5 to 6 minutes and then rest. For 3 times a week was capable of partially reducing muscle loss in those particular muscle groups. But it did not prevent changes in the disc volume, disc morphology, spinal length, or lordosis shape. Also, while a similar number of subjects in each group reported low back pain during bed rest, the exercise subjects reported low back pain more frequently, and this was significant in the with the group that basically did exercises and was more mobile. Furthermore, there was limited evidence for an additional effect of whole body vibration on high load resistance exercises in these changes in lumbar spine muscles. So they basically are saying that there's really, the main changes that they noticed were the things that I talked about. The main changes were, I'm going to show you on a little guy here because it's easier for me. They show the difference in the height here of the bones because the lost disc space. That was a major change. It changed the curve itself. This lordotic curve started to straighten out. And the other major thing that they looked at and said is that the actual, besides the disc height, the actual morphology, the shape of the disc, instead of being a nice cylinder, it started to change shape after being immobile for that period. And unfortunately, it did make some recovery with resistance-based exercise. So the proof is in the pudding. If you're having resistance-based exercises, when you're having these muscle groups that I talk about, the quadratus laborum, the multifidus, the erector spinae, all these muscles, those are the deep muscles that make the things move. So if you look at those pieces right there in that particular muscle groups, you're going to notice that with that pain when you have those particular groups. Hey, how you doing? as I ramble on there a little bit. I'm not sure if that made sense just about 5 seconds ago. So let me go ahead and back up there for a second. This particular study essentially said that you're going to have changes in several things. You're going to have changes in disc height. You're going to have changes in the shape of the disc. You're going to have changes in the length of the spine. And you're going to have changes in the actual curve. You're going to lose that nice lordotic curve, and it's going to start to flatten out because of the lack of resistance and more non-weight bearing in those patients that have back injuries. And so if you get them up and get resistance exercises, even though it hurts, it starts to change things back to where it was supposed to be. That's really what this study shows. Now, it does go into details of other things. They talk about this whole body vibration. And I'm going to tell you the truth here. I'm not a big fan of this whole body vibration nonsense. It's one of those newer things that's out there. I'm trying to get into some detail here for you for a second for it. I'm trying to find it. Most of it is a bunch of statistical numbers if you're wondering why I'm just not telling you about it. Because a lot of it you guys are just going to like fall asleep with. And don't blame me, I would fall asleep too at it. They did say, though, also, because the whole premise is this going to help you at home? Yes. The whole premise is this, when I talk about this particular study, which I'm going to give it probably a 2.5 or 3, is that if you don't exercise and you kind of just lay around for weeks on end because it's hurting, you're not helping yourself. You're actually making things worse because all those things start to change. The disc height, the alignment, the muscles start to atrophy. You start to get fat tissue within those muscle groups, and it's only making yourself worse. So when everybody says, no pain, no gain, well, yes, the first 3 to 4 days when you have the initial inflammatory phase, that's correct. But if you come to some of my videos, I'll show you the correct way so that you don't hurt yourself and also that your recovery will be much sooner. So if you guys have any questions about this, go ahead and leave me a DM down below. Hopefully I can help you guys out and hopefully give you guys some feedback if you guys leave some messages for me. Like I said, I'm going to go ahead this weekend and go into those 2 muscles, the erector spinae and the rotatories. And hopefully you guys like that one. And hopefully give me a thumbs up. But until next time, Scully and I always like to say, look up and keep smiling. See you next time, folks.